Happy Tuesday to you. We are drilling down into 15 priorities that are really, really important for St. Stephen to get right in the next 4 years with the next council. And obviously, as someone who is offering to be your mayor, I am very interested in how to solve these challenges and issues. We have a safety challenge. We have a safety problem in the municipal district of St. Stephen. Last year, there was a group who conducted a survey. They were called the Canadian Centre for Safety Communities. They polled St. Stepheners. About 400 of us did respond. And 85% of people in St. Stephen did feel safe in their homes. So that is the good news. The not so good news is that 57% were concerned about experiencing a crime themselves, and 47% of respondents felt like that concern actually curbed the kind of activities they wanted to do. Certain places where they wanted to walk, certain times of day where they would or wouldn't walk. And so obviously we have got to get this right and address this with your next council. In my opinion, a lot can have been done already, but I just, having watched 2 years of council meetings, I do see a bit of a lack of resolve and a bit of difficulty with coordination. And I've said before, with so many of these challenges, what we need is coordination of multiple agencies, people who are mandated, organizations that are responsible for certain areas. And then we need to cooperate together with a plan. So coordinate, then cooperate, work together. And you are seeing a breakdown of cooperation in certain areas. And then communicating with each other on an ongoing basis, that regular feedback, and communicating with you what is being done and what is happening. But then, of course, not stopping there, a really measurable feedback mechanism, whereby you as residents, we as residents can communicate to council and the people who are working on this, whether or not the work is actually making a difference, moving the needle at all. I want to talk, as I mentioned in the Meet the Candidates event in response to the question of safety, and I did say then that MLAs were asked, how are you going to improve safety in the St. Croix riding in 2024? I stood there and answered that question. I looked at the mayoral questions from the Meet the Candidates in 2022, the 3 mayoral candidates at that time, and that same question was asked. So here we are all these years later, still not having solved the challenge, risen to the solution of the problem of that feeling that we are not safe. When we don't feel safe, we aren't safe. There is no amount of statistics that can say, well, crime is going down or police calls are going down. If you don't feel safe in your community, you aren't safe, and tangible work needs to be done in terms of objectively accomplishing steps that will improve the feeling of safety. I want to talk about Duncan, BC. That was one of the communities that I mentioned. I can talk about a lot. Prince Edward County, Ontario, Miramichi. There are multiple communities that really tackled their public safety problem, people not feeling safe, and able to point to specific things and say, that right there, that is why I don't feel safe. I want to talk about Duncan, BC, because it's similar to St. Stephen, different in other ways. It is a hub. It's technically the boundaries of Duncan, BC are 5,000 people. It serves the entire Cowichan Valley, though, which has a much greater population than that. But again, the serving of that small community, serving that entire sprawled out population in BC, feels a lot like here, where we do have a hospital, we do have provincial offices for addictions and mental health right here in the middle of town. We have the grocery stores and other services like that. We will have a collaborative care center next year. I talked about that yesterday, the provincial services we need. So in that way, it is similar. In terms of population, it's similar. We might not have kind of that urban sprawl where we're a bedroom community, but St. Stephen does serve all of Charlotte County. What Duncan, BC started to notice is their public safety started to slide as well. And where that was occurring was specifically in, and this is another way that we relate to them, is a concentrated area. We don't have the sprawl in St. Stephen. We don't have bad neighborhoods. We are seeing the people who are experiencing homelessness and particularly drug use more or less concentrated in the downtown. And I would say the Milltown Park, where the bandstand is, there's a lot of activity there. And when people in the past have not had anywhere to go, they go out to Elm Street Park, a lovely hiking trail that I've enjoyed with my family. People have enjoyed going out in that amazing asset that I feel needs to be better developed. That's another video for another day. But people started saying, well, I don't want to go in there because I'm finding encampments. I'm coming across people who are elevated or under the influence of substance use or that kind of thing. And that is one more example of how we need to get this right. So back to Duncan, BC, they were seeing open drug use. They were seeing kind of litter. They were seeing people loitering in certain areas, asleep on the street. And that affected people's safety, and it was in concentrated areas. What they started to notice, though, is that this was a housing issue. People had nowhere to go in terms of housing. Again, think of and look at these similarities of St. Stephen and Duncan, BC. But then also, there was a lack of addictions and mental health. The health piece was not there. Addictions and mental health is part of the, that's a health issue. When you are addicted, it's a neurotoxin. You are suffering from a medical disorder when you have an addiction to substance. So this is a provincial issue, the health issue. Housing is technically a provincial issue. And it also came down to policing. Just like here, Duncan, BC is policed by the RCMP. There are extreme limits on not just the contract, what the RCMP can do with the limited personnel they have. When I ran for MLA, I said I need to go to Fredericton and we need to get more patrols, more money, just a different way of policing down in St. Croix. Well, now here we are in St. Stephen with a similar issue. We don't take it out on the officers. The officers are doing what they can with the resources they are given, but it comes down to not feeling like we have enough patrols and enough public safety resources, which is why yesterday I talked about all the ways the province needs to get involved. Now, a lot of the time, too often in St. Stephen, that is where the conversation has ended. We need housing, that's provincial. We need healthcare, addictions, mental health, detox, rehab, that's provincial. Policing, what can you do? A place like Duncan, BC did not settle for that. A place like Prince Edward County did not settle for that. Other communities did not stop there and say, what can you do? And that's why, again, I'm asking to be your mayor, because I will not be satisfied with those answers. We need to make budget allowances. We need to make a plan to bring in together and bring together the agencies and the solutions and start tackling these one at a time the way Duncan did. So to me, people have asked me, what's your safety plan? To me, it starts with a focus on the hot spots where we are seeing disorder. And that, of course, is around the shelter. That may be in places like the Milltown Bandstand area where people are looking for shelter. That may be all of the shops along the downtown who are wondering about safety. I've said it before, shopkeepers are not responsible for keeping the neighborhood safe beyond the threshold of their door. That falls to the municipality. It may cost some money. I would like to pilot out a way that we can get kind of what other communities like St. John has done, what Duncan has done, an increased bylaw presence. And that might mean uniforms and patrols. You can do it at certain times of the day or night. That is part of taking an inventory of safety like Duncan did. Where are the places where there are problems? But get this, not just the places, the people. When I was researching Duncan, I did find that what they discovered was it was actually a small handful of people, believe this or not, who are causing a majority of the disruptions. Let's say there's 15 or 20 people in town who are causing the disorder, the disruptions, dropping needles everywhere, using in open spaces. You will see those same names come up again and again and again. And you know, frankly, without demonizing people, there is a proper place for shame. Shame can be helpful. I don't mean shaming someone. I mean, you should not behave in that way in our community. It's not okay. It's eroding people's safety and people's quality of life, right? The problem that they saw in Duncan, BC was the police knew all these people, and all they could do was pick them up, book them, and then release them again over and over, because BC, like New Brunswick, had a justice system problem. We need to pressure the Liberals. I mentioned yesterday, the Minister of Justice. We need to always be talking to Minister McKee about the justice issue, Gauvin about public safety. These are really important things that we need to be advocating in St. Stephen. So I would want to focus on patrols that focus around certain places, picking up needles, going into shops, kind of like a community patrol. This is what's happening in St. John with their community safety, service team. They just go into shops, they walk around, they're very visible, they help tourists. It's about presence, it's about helpfulness, it's about people feeling safe and responding when a shopkeeper doesn't feel safe, and maybe people feel like it's not quite elevated enough to be a policing issue. There's that issue. Also, crews that will go around and pick up needles, look for drug paraphernalia in specific spots. This is not hard to do. Again, other communities have done this. And if you think, well, who's going to do that? I am blown away that our fire department is mostly volunteers. These are incredible men and women who volunteer for the extremely difficult job, everything related to fire and rescue. We can do the same here. I'm not suggesting it needs to be volunteer necessarily. We can pilot out patrols in that way. But at the same time, the housing issue. I've talked about how with Future St. Stephen, not only do we need to be continuing to add housing units and activity downtown, if shops can't survive downtown, then we need to fill that with housing. We need to allow zoning that will allow housing in downtown. We see things like the daycare, Boulevard. There are services downtown, the federal buildings. Anywhere that there's people, there's more activity and there's more safety. So I want you to reimagine a downtown, not the downtown of your youth where there's lots of commerce happening and lots of shopkeepers. Those days might not be here for quite a while with online shopping, with a population that doesn't seem to be able to support with disposable income some of the shops that are opening. But if that concentrated area became a place where people lived and played and worked, then you would see other places opening up like restaurants and crucial services, and that's how a community grows together. So I'd want to see that happening. I would want to then, of course, see, so the more housing, but the housing continuum, we need to take the pressure off the shelter. I've got another housing video coming up, but just like Duncan focused on individuals who are problematic in the community and made sure some of them needed to be charged with crimes and incarcerated, others just needed the mental health supports. That was sometimes housing, the social supports. That was sometimes enough detox beds. That was sometimes detox and then not releasing them back into homelessness, right? This is the kind of thing we need. Maybe we do need a dry, the wet and dry debate, a place for transitional housing where there's a place for people who are coming out of detox, kind of a group home. I am so interested and kind of like doggedly insistent that we need to fill in these gaps. And you do it with a community safety action plan. That's what all of these municipalities that have tackled this have done. And then you advocate with the province for that policing piece. And if not, saying, okay, police, you need to do more, because the RCMP tend to push back and say we are at our max. The police need to work with community safety service. And that's where I've seen some reticence on behalf of the RCMP. That's what I've heard about with other people inexplicably, we just can't get these people to work together. That's where, again, we need to hold the value of coordination and cooperation and then communication back and forth. So that housing piece with Future St. Stephen, the housing, the bridge housing with the province, the increased policing or working with policing with the province, and then making sure the health care that we need comes here as well. That's how other communities have tackled this. Housing, health, and policing. And that policing can be a community service network as well. Then you just, again, target certain spots, make sure people feel safe, and you will see those improvements. You kind of say, well, it's a big problem. There's too many things to tackle all at once. That's right, it is. but one at a time with a community safety action plan, literally ticking off the box and saying, we have this now, we have this now. Where are the gaps? We have this now. Going back to the public saying, do you feel safer? Is this working? Is what we're doing working or not working? Do you want to continue to invest budgetary money in a community safety service like patrols or things like that or not? Can we get volunteers? How much money are we going to put towards this? But this is a problem that we all need to solve together as a community, and the best way to do that is not say it's just a policing issue. It's just a healthcare issue. It's just more housing. It's actually all three, and communities that have taken that inventory and made a smart plan, a smart, specific, measurable, actionable, result-based, right, and time-bound. That's where you need to get a plan like that and then communicate back and forth and say, are we making progress or not? That is the kind of thing that I want to bring to the equation. And starting with the Wellbeing Task Force, that the Community Wellbeing Task Force that we actually have already in place. It's got a member of the RCMP, a member of social development, a member of council, a member of staff. It's got 3 members of the community. That is really important. I just want to make sure. Council, staff, RCMP, social development, 3 members of the community. That's the place where we start and then actually make a plan of how to move forward and improve this so that you as a resident feel safe. You're not safe until you feel safe. I want to say that again, but also we're not well until all of us are well. And that means getting the problematic individuals the help and the care that they need. That might look different. Again, sometimes that's a police and a security issue. Sometimes that's a healthcare issue solution. But let's bring those things to the table together. I'm really excited to work on that together. And that's just the way that we need to build up St. Stephen's so that we start to be able to respond to a survey. Do you feel safe? Yes. We want to see that 40% number come down. We want to see that 59% number come down where you don't feel like your daily activities are interfered with or you feel like you might become a victim of a crime. All right. BuildUpStStephen.ca, priorities, commitments, and we are in the last week of these 15 commitments. Today was number 8, I believe, 9. But I would love to be the one to work on this together with your new council and with you. Have a great rest of your Tuesday. We'll talk again tomorrow.